So thank you, Mr. Lundy, for doing this interview with me on behalf of persons with disabilities in our state. Um, and I just had some basic general questions for you, that I sent along the way. But just to get us started, what is your assessment of accessibility of healthcare and home and community-based services for individuals with disabilities in Louisiana?
I think an effort's being made, but it needs to be improved. I think that accessibility has to be improved. I think the entire system has to be improved. So you know a little bit about me. I had a law partner for 10 years that had Asperger's, and one of the brightest lawyers in our office. Um, I have a son who has a brother-in-law that is autistic, and he's extremely bright. And I've been able to personally observe how what I tell people with disabilities, they're really people with abilities, and our state needs to understand that. And that's who we are, and that's who I am, because I've had experience. And then I had a nephew, my great nephew, my brother who's deceased. His grandson was born with a mitochondria deficiency in the DNA. It was one of the rarest conditions known. And so he's gone through some struggles, but he's about 8 years old now. He's being mainstreamed education wise. He's a brilliant child. He just has challenges. And so we have to do everything we can to help that portion of society, which is is part of it. And so I have a heart to do this the right way, and I'll have an improvement. The governor may have a liaison right now to the disability community, but I will have a one within my office as the next governor, that we will stay attuned to it, and I will have an open door policy. Obviously, I have one with this interview this morning. I welcome this interview, and I'm glad you're doing this interview. And so, can we do things better? Yes, we can. Unfortunately, Medicare, to some degrees, has made it very difficult on people. And that's a federal issue. That's not so much a state. All I can do as governor is state my opinion, take my actions. For example, if you have someone, I've made a note, if you have someone who needs speech occupational therapy and they meet the criteria for Medicare, there's copay, there's cap rules, there's all kinds of stuff within Part A. And that doesn't even deal with parts B, C, and D, and vice versa. So it's very convoluted. We need to make it more simpler for people who are trying to reach out. And so, like I said, on that side of things, that's a federal issue. I'll be the governor of the state, but I'll be helping every way I can to make the laws more simple for people. And that kind of bleeds over into my thoughts on your second question. On the state side, I am, first of all, you asked me for for an implementation scenario. First of all, I think we got to have telemedicine involved. We need to involve LSU Shreveport medical school. We need to involve UL with their nurse practitioners program. We need to make medical benefits better available to our disabled citizens, as they're described. I'm gonna call them those with special abilities, and that we can do that with our system, and we can help people. We can explain them. So the role of LSU Shreveport and UL Lafayette is needed. It includes medicine for the disabled and the rural population. It's just not the disabled community. It's a rural population that needs help. And I think you know that. I know that. And so I feel strongly about that. And we will work in every way that we can to make that available. I want to streamline Medicaid payments. That's my second thing on my list. And filings for physicians, while also improving early intervention in schools. So, I'm of the age when I look back, when I was born and in the years that I was born, there was 1 in 10,000 people that were diagnosed, 1 in 10,000 males diagnosed with autism. Today, there's 1 in 27 males diagnosed with autism. So we have to be aggressive and we have to figure out what's causing it to. You know, my experience as a lawyer for 40 years and a businessman and having read many medical journals, many epidemiology studies, many toxicology reports too. We need to search for cause. Yes, we need to treat the effect, but we need to reduce the cause. And this autism is really, again, it's on my heart. Um, you know, I helped a friend. We started a youth camp in Missouri, and we brought a horse program into the youth camp called Horses That Help. And so I know that the parents of autistic children need as much time as they can get relief, depending on where the autistic child is on the spectrum. But I understand that there's relief. I mean, the program that we did, we put each child on a horse for an hour. We had 3 volunteers working. We had professionals, and then at the same time, we had we were cooking for the parents. We were giving the parents relief. We had blow up toys and games and stuff for the siblings. So it was just something that we would do ever so often, and we would advertise it. They would register. They bring their child. We need more of community involvement with our children that have these disabilities. So I'm going back to my list. Medicaid has to be, you know, filings for physicians needs to be simplified. We need to intervene in schools for our young people. We got to speed up times and address issues earlier. The third thing I put on my list in response to your question was we need to look at every way possible to curtail facility need reviews in the state to address primary health care crisis, which exist in pediatrics and opioids, while also freeing organizations to improve health infrastructure across the state. Get the government out of the way. So we got to have government to help, but we need to get it out of the way so the community could be involved. And so I am, you know, there's an organization and I'm from Lake Charles. I'm from Calcasieu Parish. So we have the Nicholas facility in Lake Charles that the community got behind. We got to have others all around the state, and we have them. I'm not trying to be negative towards any other entity, but you also talked about mental health. You know, we have a program in Louisiana right now called Home First. So I think we got to have community residential areas, which really I'm talking about the homeless as well as talking about mental health issues. We got to get them in, and we need you know, I'm going to use this word. We need a wraparound program. We need home first. We need to put more money in those programs, but we need to make sure when we have someone living in a residential area that they're getting therapy, they're getting medical treatment, they're getting counseling all the time. You know, society wants to put a bad connotation or definition on mental illness or mental disease. Really, all it means is, you know, extraordinary depression, extraordinary anxiety. And we see so many people today suffering because of they're homeless, because they got post-traumatic stress disorder, because they've come out of a traumatic incident. They come out of domestic violence. They come out of so many different things. I'm gonna call you Doc for short. And so, Doc, that's what we see. And so we can change that. And when we do that, we transform them and you know, we want the faith community involved too. We want the faith community involved with the medical community, and then we want to get people back living independently. So I know I'm doing all the talking, Doc, but you can, if you want to ask a question or two. I don't want to use up all my time. Just telling you what I think and you know what I believe, and so that's I'm going to be the governor that's going to be you know wide door policy, open, wide open. Anybody walks in, I'll talk to anybody. I'll help anybody. I'm in this thing for the people of Louisiana, not for a political party, not for power, not for an agenda, not to promote anything but the welfare and health and good life, quality of life of Louisiana residents.
Thank you so much. And by the way, you can do all the talking because this is your forum to tell the residents of Louisiana what you see and envision in our future. And I'm just speaking for myself. But if there's any questions that you ever have about persons with disabilities, be sure to come to us and come to my office. And would be more than willing to speak with you on any of these issues.
Well, I will do that. And I'm going to go back to what I talked about telemedicine. We have technology today that we have to utilize that technology to help our community and to help our disadvantaged or disabled community. And we can use it. There's, I don't know if do you ever watch movies?
Yes.
I watch, did you watch the movie The Accountant? The
No,
movie
I've
The
never seen
Accountant.
that one.
You need to watch the movie The Accountant. And so he was an autistic child, but he went on to be a brilliant guy, a numbers guy, and it's played by Ben Affleck, who's a good actor. But in the movie, it depicts a young lady who's severely autistic, and then when the person walks in the room, she carries a conversation through a computer. It speaks to the person walking in. I know today that there's technology for those that can't even speak, but that technology can read the brain of that child or that adult that can convert it to language that they can do it. Those things are happening today. I know law enforcement's using that technology. It's better than a lie detector. And so we've got to invest in technology so that we can continue to help children, and so everybody should be mainstreamed. Everybody should have an opportunity. I mean, you've overcome whatever challenges you've had in life, and look at you. I admire you, and I wish I had your intelligence, but I don't. But you know, God's given me some gifts. He's given you a lot of gifts, and
Yes.
so you're using them wisely. And I really appreciate what you do, and I appreciate this phone call. And so I'll be the governor that you like. I'll be the governor that helps. So that's all I got to say, Doc.
Thank you. And technology is wonderful and has come a long way because I was born in the 80s and we definitely did not have nearly as much technology as we have today. And as a wheelchair user, that technology is so helpful.
Very much so. So I'll end with this. So I had a law partner that had a nephew that was born with severe cerebral palsy. Today he's been educated some at UL with a disability scholarship, you know, and he has triggered devices in his body that allows him to walk. Now, once again, this is technology, and he's a big, tall, handsome young man, communicates very well. But I mean, 40 years ago, somebody born with cerebral palsy would be in a facility. And this young man has been raised. His aunt and his mom have really put in a great effort to see that this young man had a mainstream education and lifestyle. So that's all I got to say.
That's amazing. Well, thank you so much for sharing a little bit of your morning with us. And we look forward to speaking with you again.
All right. God bless.
Have a
Take
nice day.
care. Bye now.